In this visit, I'll talk about how we diagnose fibromyalgia. The diagnosis of fibromyalgia requires that the person have chronic muscle pain and also tender points when the doctor palpates the muscles. And it should be painful, not just tender. People often also have chronic fatigue and headache with fibromyalgia. It's a diagnosis of exclusion. That means we have to look for other diseases and make sure you don't have them before we can say that you have fibromyalgia. We treat fibromyalgia with tricyclic antidepressants and also with some of the newer antidepressants. Daily exercise is also very helpful. Other diseases can cause the same symptoms, but the treatments are different. Hypothyroidism, low thyroid hormone level, can cause diffuse muscle pain and fatigue. We check this with a blood test called the TSH, thyroid stimulating hormone. Treatment is with thyroid medicine. Vitamin D deficiency can also cause diffuse muscle pain and fatigue, and we check this with a 25-hydroxy vitamin D level, and perhaps with calcium and phosphorus blood tests. Treatment is with vitamin D. Polymyalgia rheumatica is a disease that occurs in older people and can cause diffuse musculoskeletal pain and aching. It's important to diagnose this disease because the treatment, prednisone or another steroid, works very well in this disease, and it doesn't work at all in fibromyalgia. To make sure you don't have this disease, we need to get a complete blood count to check for the anemia of chronic disease, and also to get an erythrocyte sedimentation rate, an ESR, which looks for inflammation. The CBC and the ESR will be normal in fibromyalgia. Polymyositis is muscle inflammation that usually presents with only muscle weakness of gradual onset. But in 25% of cases, there can be muscle pain. We look for this disease with blood tests that are elevated in muscle disease, creatine kinase and aldolase. Connective tissue diseases such as systemic lupus erythematosus and rheumatoid arthritis can also cause diffuse musculoskeletal aching and fatigue. If the doctor suspects one of these diseases, he'll order an ANA, an anti-nuclear antibody, and a rheumatoid factor. However, if the physical exam is completely normal, we usually don't check these tests because they are often falsely positive and lead to a lot of unnecessary extra testing. Both depression and sleep disorders can cause generalized muscle aching and fatigue and need to be considered and checked for. If your physical examination is completely normal, your joint examination is completely normal, your examination for muscle strength is completely normal, and all your lab tests are normal, and if you have painful points on palpation, then you have fibromyalgia. And then we begin the treatment for fibromyalgia. Unfortunately, the treatment of fibromyalgia can be difficult, so you need to keep working with your doctor to find the treatment that's best for you. Well, that's it for this visit. Thank you for watching, and I hope you found it helpful.